I think everyone has been on these calls before. My name is Libby Sagara, and I work with Anthem, CVeC, and HealthNet and California Health and Wellness to oversee our Central California eConsult coalition, and it's just so great to have so many faces on our call today. So we'll talk a little bit about what we've seen in terms of activity to date. We are going to give each of the clinics a brief opportunity to share some of their findings so far, some best practices and or challenges that they faced, and love to have an active discussion in terms of best practices and what people are finding successful in using eConsult. We will hear a bit from St. Agnes, a new provider as part of our coalition. We'll review our recent CME, which had great turnout, and do a quick review of the CAP enrollment process. And thanks, UCSF team, for joining. I see that you're on too. Well, without further ado, we'll get started. And for those of you who may be new, I think that we might have a couple of new faces. We like to share just our goal, which is incorporating eConsult into the referral process, making this as easy as possible for our clinics and primary care providers to do eConsult to support referral and specialty access. So we'd like to discuss this as a potential first step to the referral process and improving access to care for our patients. And we like providers to think about this as an option for all non-urgent and routine and non-procedural referrals. Thinking about this as the first step. We like to emphasize too that primary care providers maintain the relationship with the patients, and this is a choice for them. We want primary care providers to know that this is their process, and we understand that there's some work required, and we're here to help support that workflow. With that, I'm going to do a quick review of what we've seen to date. We're excited to see that we have great involvement from a number of our clinics. Some are newer than others in this process, and we're here to help those who are getting up and running. We know that summer can be hard. We know with people out on vacation, providers of course have even a bigger workload if they're having to manage different roles, wearing different hats. We understand there might be a little bit of a slowdown in summer. That makes sense. We're also thinking about our clinics that are dealing with an influx of COVID cases. We know that there's a lot going on in the FQ and the RHC world right now, and we're here to help. So great to see active involvement. We're going to hear from clinics and what's working in just a moment here. These are the clinics that are using Confirma, and you can see the volume over time. This is everything that's happened from January through June this year. And here's a quick snapshot of Clinica Sierra Vista, which is using Rubicon MD. And also great work, seeing an uptick in summer. So we know that your support is great. The work that's been done is even getting, the numbers are getting higher as we progress through the year. So that's great to see. And also we like to see that this is really receiving great feedback from primary care providers. You can see here that the eConsults that have been done at Clinica Sierra Vista are getting a 4.9 out of 5 satisfaction rating from providers. It's great to see, and wonderful turnaround time on both platforms. So it's a way to get advice that your patients need in with a much reduced wait time as compared to the traditional referral process. I'm going to jump to our provider group report outs because we have you on and we know that time is tight right now. So I'm going to go right to Clinica Sierra Vista since we were on their slide here looking at their data. And Brito, I know that you're on. Would you like to introduce yourself and review your experience to date? Would you mind doing that for us?
Hi, Libby. How's it going?
Good.
Yeah. So yeah, we are.
Go ahead. Go ahead.
Yeah, we are still at the implementation phase. We recently rolled this out to Fresno, but we are early starters on the Kern County, and we have walk-in clinic. The providers have a different aspect from a walk-in clinic. They want to receive the eConsult responses on the same day so they can close the progress note. But we continue to have discussion with our eConsult vendor, and a provider group of optimizing the workflow. In general, our primary goal is also to reduce the referrals. We always have a backlog of 40 plus thousand referrals. So we want to reduce the backlog and utilize more e-consult. That's our general goal of onboarding e-consult to our organization.
Thanks, Brito. I'm just wondering, can you tell us how you do that analysis of the referral backlogs? Do you look at the outstanding requests your primary care providers make and compare how e-consults have been used to address that? Can you describe how that works?
Yes. Yeah. So we have a central referral team. They manage. So we picked the specific specialties that mostly qualify for e-consult, and we work with some providers. Rubicon MD, our vendor, they onboard a provider, and also some of our providers. They review based on diagnosis and some additional information. So that's how the analysis was made.
Thanks, Brito. I was just going to type in our chat box. If you do have questions for those who are presenting, you can feel free to share them in the chat, or you can even unmute yourself if you wish to share. I'm just one more question for you, Brito, is how are you looking at quality? You say that obviously you're seeing high quality in terms of responses. Is this part of your quality analysis of, in terms of quality of care that the clinic provides?
Yes, our providers, I'm from IT, so our providers expressed, a great recommendation on the e-consult quality point of view. Obviously, walk-in providers have, some workflow suggestions, but we did not hear any kind of complaints or issues from a quality perspective. I think we were able to close, not really back and forth communications happening between, not a lot of communication between providers and specialists, but, with a few, one or two responses, they were able to figure out what they want. So these all are, seems like an improvement in, in the quality of closing, well, not taking to the next level of referral, but closing at the e-consult level itself.
Thanks, Brito. And one last question. I know we've had a chance to meet with Dr. Maeve and some calls. Is there anything that she does from the clinical leadership perspective to get providers engaged? Anything that you've seen her do that's worked well?
Yes. So she's actively working, and we have a call, a working session even tomorrow scheduled. So she is actually our stakeholder, clinical stakeholder of engaging providers. Initially, they have some concerns from a legal point of view as well, but that was taken care by this collusion group. It's a non-urgent, so that message was very clear to our providers. But yeah, Dr. Miave is the key team player of making the communication on and engaging providers actively to this program. But she keep saying this is the future, and we need to be ready as an organization to be part of that, e-consult initiatives.
Thanks. That's been helpful to be able to meet with her over the past few weeks, Brito. And just as you said, it's so important to have that clinical leadership. And we would love to talk to Dr. Maeve on future calls, perhaps hear some of her thoughts on this, since we really do see a difference. As you said, she's doing this, she gets her hands involved in the process. So it's great to see providers engaged. And thanks for joining today. Any questions for Brito before we move on? All right, thank you, Brito. And also thanks for the great reports you provide. Appreciate those. I'm moving on to Camarena, and I'm not sure if Dr. Ramirez is on or if we have a Camarena representative. Dr. Ramirez, are you on?
So Dr. Ramirez is not on, but my name is Chris Fasil, and I'm kind of representing the Camarena side of things here today.
Thank you, Chris. Do you have any thoughts that you'd like to share with us? Would you like me to review this for you, or have you had a chance to talk to Dr. Ramirez? Anything that you'd like to share about your initial experience?
Sure. So my experience, we implemented this e-consult process, I think, a little over a year ago. And I'm a practicing provider, and so what I've seen is that people are becoming much more comfortable within our organization of using these e-consults. Before, I think there was a lot of hesitance because it was new. As Britta was saying, kind of concerned about the legal aspect of having primary care do a lot of the management. But a lot of that has subsided, and providers are much more comfortable now utilizing the e-consult. So it's been a great addition for us, and it's been very helpful the times that I've had to use it. And so I've certainly been grateful for having this knowledge here at our fingertips. And, our organizational referrals that are face-to-face referrals take usually with our Medi-Cal population several months to get patients in with a specialist. So we usually have a 48-hour turnaround from when we do these e-consults. So that's been a wonderful improvement and a great addition to our organization to be able to use that.
Thank you so much, Chris. And I did want to add that Dr. Ramirez spoke earlier this year for us. I think many of you on the call know we were talking earlier in the year about State Bill 365, trying to get primary care provider reimbursement for e-consults. We know that this is an impact on your providers and referral team, and we appreciate the time put into this. Dr. Ramirez's testimony really brought out the great work that's been done at Camarena and the impact on access to care. And especially with the Central Valley need for specialty access, this really hit home with our legislators. I think you all know that State Bill 365 has met bipartisan approval. It's moving to appropriations now, so we really appreciate Dr. Ramirez's vocal support of this. And you too, Chris, thank you for this great input. I did want to bring up one point Dr. Ramirez had, that remaining challenges and needs from our coalition, and we are listening to this. We understand that Anthem, HealthNet, California Health and Wellness, and CalViva are supporting e-consult, but we know other payers may not be there yet. So we're listening to that. We want to note that we understand that right now we've begun e-consult for Medi-Cal patients. We're working on obtaining coverage for uninsured patients, but we know that there are still patients who don't fall under that umbrella, and we're working on that too. So we want to acknowledge that we see that. We also like to see these stories, and Chris, I'm not sure if you are familiar with this story, but it's great to have examples, and we've had some excellent examples of actual e-consult conversations between providers here, but nice to see that this rheumatology case, we know rheumatology is of high need. We're seeing so much demand for e-consults for rheumatology. And it shows that this helped that primary care provider to treat that patient's need without an in-person visit. And so many of these questions are around medication advice that is needed by the primary care provider. So it's great to see that. Anything else you want to add, Chris?
No, I don't think so. I just, definitely do feel like it's been helpful for me as a provider. In terms of examples, I can think of a couple of hematology examples which come to mind. Hematology is definitely not my strong suit, so it's been nice having those e-consults come in, and the specialist advises me to order certain labs, and some of these labs I've honestly never even heard of, and so it's a good learning aspect for us as well from a primary care perspective to be able to kind of expand our knowledge and repertoire of skills. So it's been a very good experience for us.
Thanks, Chris. Those are great examples. And you brought up a point earlier. I welcome Dr. Anderson and Dr. Tuo if you'd like to piggyback on this comment. But there are questions around patient relationship. Who maintains that relationship, and the questions around what sort of liability the primary care provider is taking on. But I've heard from various providers who've done these for 5 to 10 years that It's much better to get your patient the advice that they need through a remote specialist conversation rather than having that patient get no care at all. So we appreciate that comment. Any other questions for Chris or comments from the group? Okay, I appreciate your time, Chris. And moving on to Family Healthcare Network and Matt Miller, I believe you're on. Matt, are you here?
Yes, I am. Can you hear me?
Sure can.
All right, perfect. Well, thank you, Louis, for the chance to just speak briefly on our progress. We've been fortunate to be what I would consider to be somewhat of an early adapter to the e-consult process. It's been a little over 2 years now that we've introduced this, and obviously the numbers kind of speak for themselves in terms of our volume and you know, the level of adaptation that we've had with that process. I won't go too much into the weeds on all the things on here. Most of the specialty referral backlog, I believe many on this call would also express the same challenges with access on those specialties. At this point, all of our locations, aside from 3 locations in Fresno County, are actively embracing and utilizing the e-consult platform. We don't discriminate on any specialties. We look at all of them across the board as far as consideration for which ones to use in this format. Our dedicated referral team embraces the model and generally has had real positive experiences, especially when we talk about getting timeliness on responses and facilitating care for patients. We face the same struggles that have already been referenced as far as excessive wait times on certain specialties. So this obviously has been a huge benefit to us to help eliminate some of those challenges. As far as desired workflows, we continue to refine what we refer to as our inclusion and exclusion criteria. It's really the template that our referral team and our providers utilize to make those determinations as to what makes sense, what's appropriate for utilization of an e-consult. If it's glaring that this will likely convert to a face-to-face, then we oftentimes don't necessarily pursue the e-consult pathway. And these are things we've learned just over the last 2 years as we've refined the process of how to make this more effective and how to really take advantage of the e-consult platform. As far as challenges, I did speak with a little bit of time with one of our medical directors, and one of the things he had shared, and I might be getting a little in the weeds here, and certainly can discuss, you know, in more detail offline if necessary, but one of the challenges we've been coming across is that we get an e-consult where the individual who sent the e-consult back to us has recommended some sort of imaging. And then when we approach the insurance to get an auth for that, they're denying due to medical necessity, even when we supply the e-consult. So it could be more of a technical or potentially a misunderstanding, but that is something that we've seen occurring on a little more of a regular basis. And then on the flip side of that, also just collaboration with local specialists. So we've had some instances where the e-consult has recommended a face-to-face, and there's somewhat of a disconnect between that local specialist when we go to send them over. So we almost have to kind of start over, if you will, in the referral process to that local individual. So if there was a way to sync that process up to where the specialist is aware of an e-consult and could basically pick up from wherever that left off, definitely could be an area that I think would you know, for improvement if we're looking at those types of challenges. And then lastly, just as far as patient and provider stories, we have numerous examples just in instances where we were able to get more timely care for patients, obviously through the use of e-consult, especially on those heavily impacted specialties. And then the e-consult recommendations have also been really influential in securing sooner appointments when a face-to-face is deemed as determined as necessary. So it definitely helps leverage the local specialists or those that we're referring to for face-to-face when we show an e-consult from you know, a colleague in that specialty field that's recommending they be seen. It definitely helps remove some of those barriers where the specialist may be apprehensive or unsure of whether it would make sense for them to see the patient. The e-consult has definitely helped us support removing that barrier. So all in all, it's been a really positive experience for us. something that we considered, or we continue to reinforce with our referral staff, and talk amongst it with our providers, through our medical directors and their meetings and everything that goes on a regular basis, sharing information. So we hope to continue the process, get the three remaining sites that we have up and online with e-consults, and continue to make effective use of this.
Thank you so much, Matt. I want to pause for a second, and I'm going to ask a couple of our leaders that are on. I don't want to put you on the spot, but I don't know if Dr. Tuo, who is our clinical advisor from UCSF, Delphine, do you have any thoughts on how you have coordinated, considering you probably had the same situation where an e-consult has been done and then a referral may occur with a specialist who did not do the e-consult? I'm just wondering if you have any advice there.
Yeah, thank you for the question. I think this, just in the bigger picture, I think this is helpful to think about as we try to maximize the folks doing e-consults to be local specialists as much as possible, just to maximize or optimize those longitudinal collaborations and for continuity of care. Nevertheless, I do think sharing the e-consult as you have been doing prior or with the actual referral is incredibly helpful, because then the specialist who is going to see the patient or has gotten the referral to do the face-to-face visit understands what the other specialist had been thinking and why the face-to-face visit has been thought to be important and necessary to further that patient's care. It's often also helpful to see what the e-consultant has recommended in terms of tests to be done before that visit can be scheduled. In our system, even though, for example, we all share the same EMR, we only have one person doing e-consults. So the the providers who actually see the patients are often not the same person who did the e-consult. And so even though it's one system, we have the same problem or the same potential issue. And again, I think just sharing that documentation or having that documentation of the e-consultant's thought process is incredibly helpful.
Thank you, Delphine. And we really appreciate the candid feedback we get here. You know, the whole reason for having this coalition is talking about challenges, you know, trying to figure out how do we address this so that e-consult can stick and be accepted and embraced by our providers. So when we see challenges, like if we have to address, how do we figure out what's happening with these denials due to medical necessity, we'll make sure that we escalate that. If any of our payers have any thoughts on that, great. If not, we can take that offline since I know that's a concern.
And can I just ask, for the medical necessity piece, that was specifically related to imaging or diagnostics that have been recommended by the specialty e-consultant, correct?
Yes, yeah, that's what was relayed to me by our medical director as far as the occurrences that are happening. It's when the imaging is being ordered by the e-consult or recommended by the e-consult.
Yeah, I wonder if we might be able to give feedback to the e-consultant group or the vendors if they recommend imaging, maybe recommend a CPT code or a specific ICD-10 code to be associated with that, or some type of verbiage that would easily portray why that imaging is important. I don't know if that would be helpful or not.
Jeffrey, did you have a thought on that? I noticed that you took yourself off mute. Were you going to respond?
Yeah, this is Jeff with CVeC. I was just curious in terms of when you say imaging, are you talking more the advanced imaging services, like trying to get like a PET scan, CAT scans, and some of those more advanced imaging, or just is it all imaging, just even basic like radiology, simple ultrasound? I wanted more clarity in terms of when the challenges are falling.
Yeah, and this is Matt with Family Healthcare Network. Unfortunately, I don't have too many more details beyond what was just provided to me as kind of a high level comment of feedback. So definitely something I may have to take offline to get some specific examples and maybe be able to dig into the root cause a little further. So unfortunately, I don't have anything beyond what was kind of shared at me at the high level.
Thanks, Matt. And this is
Okay.
super helpful. And thanks, Jeffrey. And those we'll take it offline and see what can be done about this.
Yeah, and this is Darren confirming we're happy to work with you on that. You know, if there's some education of the specialist that we need, we'd be happy to work with you to help address the issue.
That sounds great. I'll be sure to follow up with you with some examples with all parties involved, and we can maybe take it from there.
Thanks, Matt. Appreciate your time. Okay, and we are moving on to Omni Family Health. I think we have Lisa. Yes, Lisa is on. Lisa, do you want to give a recap of your experience today?
Yes, thank you. Thank you for allowing me to report on this. So we are currently participating in the Fresno, Kings, and Tulare counties. We have 10 centers that are actively using the eConsult. We launched this late February of this year. So far, we're using eConsults for all specialists except for dermatology and pain management. So that's the next phase we'll be rolling out, and I'm excited to do this. And the last roundtable was really helpful for the pain management referrals. And I think one of the things that I can say that really helped this progress is that the eConsult team integrated with our external software that we use to process referrals. So they worked very closely with our referral team, and they actually work in our not in our EHR, but in our external referral software that we use. And so the warm handoff and the time between moving the referral, progressing it to each status, really, really is quick. So we're not utilizing fax. There's no digging through 5,000 faxes to find that report. They're actually just handing it off electronically. And so I think that's really, really helpful. We've had a great experience so far. I think each month we get stronger and stronger. And this week we sent out our first physician experience survey. So I'm excited to see what we find there. And I'm delighted to be here. It's been a fantastic experience for us.
Thank you so much, Lisa.
It's been really, really nice. We are so pleased. Not only is the warm handoff going very well, but I also see, as I'm reviewing for quality and risk, as I'm reviewing some of the reports from the eConsult specialists and the recommendations that they're sending back to our providers. And then I see the physician also taking that advice and progressing with that patient care further and not sending them out for a face-to-face appointment, but actually treating it in-house. And it's really a nice thing to see. And I think it definitely helps during this time, where it is very congested getting in to see specialists, especially during the pandemic. So thank you very much.
Thank you so much, Lisa, for your time and thoughtful input here. And I love this physician thought here, this quote. In addition, having the providers really think about the patient, the fact that this is saving patients time and money. I'm thinking you're probably meaning due to travel and time off work, and that's really what we want to be able to share with our patients, since often this isn't something patients even know is happening, right? So if that's something that we can convey to them, that's wonderful. Appreciate your time. Any questions for Lisa? Great. And I'm not sure if Darren, if you want to speak to provider or physician experience surveys, but that's something that we're all working on. It's something we're going to be excited to see with regard to provider satisfaction in general. And I'm not sure if you have any comments on that process. Anything you'd like to share there?
No, just that we're excited to see the next round. We've used provider experience surveys, for many years, but we've just refined and tried to narrow. We used to ask, but honestly, we used to ask too many questions, and so I think we've narrowed it down to just some core essential questions, and we've put our team on a regular cycle where 3 months after starting, we try to get the assuming that implementation has gone smoothly, we get our first round up, and then on an annual basis. So we're excited to see the next round, and particularly to see what we get from Omni, and we'll continue to roll those out organization by organization.
Great, looking forward to seeing them. Okay, we are at our last report out here, and I believe that Sean is not on our call today. If we have a Valley Health Team representative, please do go ahead and speak up, but I think I'm going to cover this for them. And is anyone from Valley Health Team on? Okay, well, Valley Health Team, this is what's nice about having this candid group and candid conversation. They've had some transitions, and as we've all seen across clinics, we have leadership transitions, we have referral team movement, and it does take some time to get new team staff members up and running. And Valley Health Team is honest about that, something that they're going through, but they have an excited new referral manager who's going to be overseeing this. And also just provider education is something Valley Health Team brought up to us. We as a coalition are happy to meet with your clinic groups, with your provider teams. If there's a regularly scheduled provider meeting, perhaps an all hands staff meeting, we can do this in 10 minutes, right? We can just talk about some of the value that we're seeing across clinics to patients with regard to increased speed in terms of access to care, resulting in what we're seeing, up to 80% avoidance of unnecessary visits for your patients. So we're happy to share these points with your providers to encourage adoption. Any questions for any of the groups that presented today? Okay, we have a couple of other updates that we want to share with you all, and we'll be cognizant of your time today. And but I did want to announce we're happy to see our group grow, and probably every month we see a new provider group or health system join our coalition. And so St. Agnes, we're welcoming as a new member or participant in our group, and Dr. Naz has been a vocal participant in past calls. Dr. Naz, are you on? I don't believe he's on today, but we did want to note that St. Agnes is going to be participating. They are interested in participating as both primary care provider requesters of e-consults and also in responding to e-consults. So we do want to encourage you all who represent FQs and RHCs, if you have referral partners you'd like to invite to be part of our group, we are open to that. We'd love to have more join in the conversation. And of course, any Medi-Cal provider is invited to join in and participate in e-consult. Quick recap, many of you were on our pain management CME last week. Thank you to Dr. Anderson and Dr. Davis who led this CME, which was so highly well received, I should say. You can see a couple of quick snapshot of some of the responses we saw. And I love some of these comments that the attendees who completed our CME surveys noted that it was so helpful to see discussions on how pain and mental health affect each other and getting guidelines for pain management and treatment with potential underlying issues. And that some of the other comments we saw that I thought was great is how wording can change perspective and increase compliance with therapy. So some of these are not even clinical takeaways, but just how to be able to communicate perhaps with patients and other providers about what primary care needs there are. So some of the nice feedback we got on this session, and compliments to you, Dr. Anderson and team, that many providers will see a change in practice as a result of the CME. So they noted that they would change their treatment and care plans, utilizing different drugs, therapies, and procedures, that they are improving and adapting to telehealth, and they'll change their evaluation and assessment approach. So very well received session. So thanks again. We do want to capture your feedback, those clinics that are on. If you have other topics that you'd like to see us incorporate into CME sessions, we can do that as our coalition. We are happy to offer more of these sessions, especially when we have 80 people show up to these sessions. It's amazing to see. And these are continuing medical education that are open to both primary care and specialists. However, many of the folks that attended our last call were not clinicians. They just wanted to learn more about the topic, and we're open to that too. So we're happy to offer more of these sessions. You can use the chat if you have ideas of other topics we might incorporate. And I think everybody has my email address if you have ideas that you might want to see incorporated into CME. Quick little policy update for those of you who are following what's happening at the state level. So Assembly Bill 133 was signed by our governor, and we're excited to see that this not only means that Medi-Cal telehealth policy that was started during the pandemic will be continued through the end of 2022. We're not seeing any immediate impact on e-consult reimbursement. But what was wonderful to see is that there was a specific item included in this bill for statewide e-consult service for behavioral health for pediatric and family practice providers. So it's going to lend itself to our next topic I'm going to move on to in a second, but it's great to see behavioral health and e-consult called out specifically in this bill. We don't have any specific detail around this right now. We know it's still in the planning stages with Department of Healthcare Services, but we'll keep you updated when we hear more about what's happening with regard to the bill. And with that, I'm going to let our UCSF representatives who are on today talk a little bit about the CAP program. We've brought this up on our last couple of calls, and this is our call out and our reminder to enroll in this free program. So Dr. Sambushal or Dr. Reeder, would you like to speak to this?
Sure, I can just jump in and
Yes.
And also welcome Michelle chiming in, but it's nice to see everyone again. And we do want to really encourage enrollment in the program. This is a free program and really intended to expand access to mental health care. There's a 2019 RAND study that showed that these programs really do expand access to mental health care. And it is so sorely needed right now more than ever in light of implications from the pandemic on mental health across the board, across all ages. And we are going to be offering e-consults as part of this service. And you'll hear more about that, I think, at the next roundtable discussion next month. We also want to make sure that that providers can benefit from not only the direct consultation component, but also the educational component of our program. We have a really exciting webinar series that we've just launched for this year that focuses on commonly presenting mental health disorders in primary care, and then also an e-consult, a Project Echo series that involves case-based discussion. And so would really welcome you asking your teams, what they would like to hear about, what topics are really of interest. Ones that we've been hearing about are anxiety around return to school and related conditions, depression, concerns for learning challenges. Everyone has been feeling like they've had ADHD, I think, in the past year. So we're happy to speak on any number of topics that are related and would offer CME as part of that. So I just want to highlight here that the enrollment is a fairly easy, quick Qualtrics survey that Libby just put into the chat. Thank you. And just because even if you have one provider in your practice who really wants to enroll, it doesn't mean that everyone needs to utilize the service, but we just like to enroll by practice and by group. And so would welcome connecting with you. Michelle, is there anything that you want to add?
No, thank you. This is a wonderful overview. And I think, our meeting today and just hearing from all the different FQHCs on how valuable e-consults and, this consultation model has been really underscores the, the goal of our CAP program, which is to really, facilitate access to mental health care and to improve access. So thank you. Hope we can get you all enrolled.
Thank you, Michelle and Pedro. I really appreciate your time and joining our calls. When we get out there and we're talking to providers all over the state in FQs and rural health, the one thing we hear is that behavioral health is of, a huge need right now. So we think the service is so important, and we're so glad that we can incorporate e-consult and phone consults into one service for FQs and RHCs. So it's great. This is just so timely, and we appreciate your time.
Thank you. And I'm just getting a couple of direct messages in the chat around, being able to be added to our listserv for our newsletter and for invitations for the educational sessions. And so we are happy to add anyone here onto that listserv. If you'd like to just put your email into the chat, that would be great. And we'll do that. Thanks.
Thank you, Berta. And I'll make sure that I get my email address to you so that I'm on your listserv. And what we try to do is incorporate any of these opportunities like this free program into our monthly newsletters for our Central Valley group, so everybody has the same information. So we will make sure we coordinate on communications. Just a quick reminder that we have had a good number of questions from our providers about who responds to e-consults. Where are these specialists? And the ConfirmEd panel and the Rubicon panel are Medi-Cal enrolled California licensed providers who respond to e-consults. And it's great to have providers from across the state to respond to these questions. However, we do want to encourage local providers to participate too. So those of you who are on from primary care, please do share with us if you have groups that you'd like to engage in the process. Have them listen in on our monthly calls, understand that you're doing e-consults and that you're excited to engage local specialists. We're glad to see St. Agnes jump on board. Valley Children's is jumping on board. We'd love to see additional local providers get involved. And with that, I just want to remind you all of, we have resources for you all available on econsultworkgroup.com. The Central Valley eConsult Coalition materials are also housed there, econsultworkgroup.com. I'll put the link in our chat so you have access to it. And it's also in the email that you received from me earlier today. The meeting reminder has all those links for you. And you do get our monthly newsletter. If you're not getting it, please do let me know, and I'll make sure that you or your teams are added. If you have anyone else that needs to be added to our group, our invitations, or our newsletter, please do let me know. And with that, we just want to thank you for your time. I'm not sure if Karina, Mark, Jeffrey, if you have anything else that you'd like to add as we wrap up. Karina, go ahead.
Hi, Libby. Hi, everyone. This is Karina speaking with Anthem Blue Cross. Just great presentation. I'd love to hear all the feedback today from all the FQHCs and just seeing how far all of you have come with implementing e-consults into your health centers. All the feedback is just really great to hear of how it's going and how useful it is. So yeah, with that, just thank you again, and looking forward to our next roundtable.
Thanks, Karina. Jeffrey, go ahead.
Yeah, and I want to say thank you as well. I think it's been very great to see all of the provider spotlights and see the data and where we've come from in the past to where we are now. I just want to thank everyone again for getting on board and trying to integrate it into your systems and diligently to up and running for the area as well as for the patients. I think some of those areas where we, like Matt brought up, that if we're seeing some concerns, we can work on those offline and kind of see if we have some solutions. But overall, it looks like this is good, and people, it's fun that it's people are able to get in and patients are able to get care needed more timely. So overall, great job.
Thank you, Jeffrey. Mark, did you have any thoughts?
Yeah, just reiterating, so thanks, Libby, thanks for everybody that's joined. I think this is really a very valuable, important service for our members. And we appreciate the partnership to be able to work alongside you. Again, if you guys are experiencing challenges, especially, in my own world, those that could be helped, that the help plan can help resolve, please don't hesitate to call those out. I mean, that's what we're here for, and we want to get those out of the way so this program could be as successful as possible for you all. So thank you for, for the feedback that we got. Keep it coming.
Thank you, Mark, and everyone who joined today. Please do let us know if you have any questions. I'm going to put my email along with our workgroup website in the chat here in case anyone needs that. And have a great day.